Hello once again. So I'm really glad to meet you again once again. Welcome to DBMCI. Welcome to eGurukul app. Myself, Dr. Varsha Gupta. I'm a biochemistry faculty with DBMCI and eGurukul. And our today's topic is COVID-19 and its myths. Well, there is a lot of rumors about what to do, what to eat, what not to do, what can lead to COVID-19, what can help us cure. All these myths are we are going to bust all of them one by one. First is about mixing disinfectants. Well, that every other lady is doing in every home, in every shop. We have seen this. Let's say we have a Lysol, we have a sanitizer, we have a germ killer. We all are mixing them up to create something new. We are becoming a scientist. Is that right? Is that wrong? We are going to discuss it today. So wait until we discuss it. Whether taking a hot shower, whether sitting in the sun, whether if we have like really hot weather outside, it's boiling 40 degrees Celsius outside, is it going to kill the SARS-CoV virus? Watch for it. The cold weather, the snow, is it going to kill the SARS-CoV-2 and virus or not? Another question, big question. Antibiotics, wow. Most of the pharmaceutical companies are selling antibiotics like hotcakes. Is taking antibiotic really helpful in treating SARS-CoV-2? Is helpful in treating COVID or not? We will see to it. Dexamethasone, the corticosteroid, helps us to cure COVID-19 or not? Drugs like hydrochloroquinone, chloroquinone that we have seen almost 1 year back when the first wave of COVID just started. Everybody was stockpiling, give me the chloroquinone, give me the hydrochloroquinone, and boom, in blink of an eye, all the raw materials of the chloroquinone and hydrochloroquinone was gone. Was it really helpful or not? Thermal scanners, hand dryers, UV lamps, UV radiation. Does that really kill the SARS-CoV-2 virus? Houseflies, mosquitoes, are they transferring the SARS-CoV-2 virus from one place to another like they spread the infection of the malaria? If we walk with the shoes, if with the same shoes, if we come inside the home, are we carrying the SARS-CoV-2 virus in our shoes or not? Whoa, swimming, summer is, it's really hot out there. Is swimming really creating a SARS-CoV-2 virus or not? Mask, wearing mask, how should we be able to wear the mask properly? Take it out, place it properly. What kind of masks are there? What kind of masks are useful? We will discuss about that. Everybody is after, okay, take vitamin C, take zinc, take this supplement, take that supplement that is helping us to treat the SARS-CoV-2 or not. Hand sanitizer, what kind of a hand sanitizer we should be using it? What is recommended by WHO, right? And what I mean, while buying for a hand sanitizer, what should we look for inside the label? Okay, eating in pepper and garlic is going to help you for this or protect you against the COVID infection. Age is a factor, whether old age people are more prone to getting the SARS-CoV-2 virus or the younger people are getting the COVID infection, or males are more prone to have the COVID-19 or females are more prone to having COVID-19. Rinsing nose with a saline is treating the SARS-CoV-2 or not? Pneumonia vaccine, taking pneumonia vaccine is helping us in this pandemic or not? We will discuss all of these one by one. Wait for it. First of all, alcohol-based sanitizer. Well, guys, alcohol. Alcohol is ethanol and methanol and isopropyl alcohol. Methanol is very dangerous alcohol, and over-the-counter hand sanitizers which contains methanols are big no-no. Don't try to buy it. If you buy it, go and check out your hand sanitizer bottle. Keep it away from the children and avoid so that somebody can drink it or consume it. Alcohol sanitizer, some are saying using too much of alcohol sanitizer every day is going to make your skin bad, it can cause you the rashes, there can be certain infections. Well, they can be used very often. Alcohol based sanitizer which contain isopropyl alcohol, ethanol, can be used multiple times a day. Now there are new sanitizers out there in the market which have the emollient properties. They do not bleach your skin, they do not irritate your skin, and it is safer for everybody to use, be it a small kid, be it a woman, be it an old male, be it an old female. everybody is safe, can safely use the hand sanitizer, alcohol based hand sanitizers. Earlier, though I don't believe in all these things, but earlier it was think that the Muslims, they were avoiding the alcohol based sanitizers because their religion is not allowing. But see, the Islam says any medicinal thing, anything that is made by human and that can alleviate any disease is allowed by allowed by Quran. So it can be used. There is no religious prohibition on that. And one big thing about this using the alcohol based sanitizer is, if you are wearing gloves, keeping the gloves on all the time is very complicated. We feel very suffocated because air cannot go out. So if you rub your hands often with the alcohol based sanitizers, you don't have to wear the gloves. Gloves are specifically meant for specific purposes. Most of the time it is used by the healthcare providers, your nurses, your doctors, those who are taking the samples, all those kind of people. Now, whenever you are going to, let's say, to buy a groceries in a supermarket, you're going to a mall for shopping and everything, there is these communal bottles in which you have to push the pump and take the alcohol. Some people are thinking we should not touch it, it can give me the COVID infection. Well, guys, there is no such harm. This is completely a pure myth, because when you press the pump and then you rub the alcohol, if you have the infection, if you have the SARS-CoV-2 virus from the pump of the bottle, then after rubbing the alcohol, it gets killed. So there is no harm in using the community bottle. It is under now the WHO essential medicines that alcohols are very useful and they should be made available anywhere on the urgent basis. And amount that used does matter a lot. If you take a little tiny amount which does not cover your surface area, and how you use it, you take a little bit. Let me show you, let me demonstrate you. You take this is the hand sanitizer by Dr. Sabarwal here. So you take good amount of hand sanitizer, you rub across your skin, in between your fingers, with your nails, and then you every single thing in between the nails also, right? So that's how you really, like, very well you should rub your hand with the alcohol based sanitizer. Well, this was the very big setback that many people are been thinking, that if alcohol based sanitizer is killing SARS-CoV-2 virus, why shouldn't we drink more alcohol? That is going to sanitize us from the inside also. Drinking alcohol does not protect against you the SARS-CoV-2 virus, and it is very dangerous. So don't do that. Some people back there in this, as you can see from here also, from this slide, let me take my pointer out here, is the in Arizona, in New Mexico, in such kind of a big cities, people swallowed hand sanitizer so that they can be cured from SARS-CoV-2 virus, and all this killed them because of the methanol poisoning. Because the sanitizers that were available earlier over the counter contained methanol. Methanol is not like ethanol. Methanol is a substandard, you can say, alcohol for drinking. Like in India, we have this kachi sharab, that is methanol, and that causes the blindness because it produces a formate ion which directly affects the senses inside the eyes. And another setback, blowback, was in the Iran. Up till now, 700 people have died because of ingesting toxic methanol. So that's why there is this WHO advisory not to substitute, or not to give away the methanol based sanitizer, not to keep the methanol based sanitizer over the counter. The common people should have the sanitizer in which the label is indicating it contains isopropyl alcohol or it contains ethanol. Right? What are the effects? Let's say accidentally you have ingested, or somebody has ingested the methanol and ethanol poisoning. Well, the effects of the methanol and ethanol poisonings are similar. The patient will experience the headache, the blurred vision, nausea, vomiting, severe abdominal cramps, and loss of coordination of the hands and the body. Everything will be falling apart, decreased level of consciousness. It will be like, मैं कहाँ हूँ, मैं क्या कर रहा हूँ? Like he will not be able to understand what is going on, right? And the The person with methanol poisoning may develop the seizures, the blindness, and the severe anion gap metabolic acidosis. That is the important thing to watch out for, because if this happens, the blindness is for sure. Any patient who has ingested the methanol, who has been suffering from the methanol poisoning or accidentally took the methanol based alcohol sanitizer, all are blind. And believe me, many of them who are discharged from the hospitals, after they come home, in a week or 10 days, most of them are dying, very few are surviving. So it's a big no to the methanol based hand sanitizer. Don't drink. Educate everybody around you, educate everybody in your home, because the charity begins at home. So tell everybody not to ingest alcohol. You should avoid it, and you should not have methanol based alcohol sanitizer at your home at all, right? If left untreated, it can be fatal. Visual impairment is for sure. Okay, there is this case in which a 44-year-old man at a healthcare facility on recent onset of visual impairment, right? And what was this? Because few days back he has drank the alcohol-based sanitizer, and when the blood test or biochemical test were ran, the blood methanol concentration was 97 milligrams per deciliter. Metabolic acidosis with an anion gap of 32 milli equivalent per liter, indicating the methanol poisoning, right? And the clinical course was complicated by the seizure. The patient was treated with fomepizole and underwent hemodialysis. After 6 days of hospitalization, when he recovered, his body was cleansed. Cleansed for the methanol. Still, the patient was discharged with a near total vision loss. So, big no to the ingestion of the alcohol based sanitizer. Is mixing alcohol, ethanol, bleach, whatever cleaning agents you have in your home is good or not? It is not good. It can be extremely dangerous, because we are not the chemist. We don't know what chemical ingredient can react with the another chemical ingredient in the second bottle. It can cause the toxic fumes that actually have proven to be fatal and dangerous for the people. Like, you should not mix the methanol, the bleach, the ethanol. It is very dangerous. Why it is dangerous? If, let's say, bleach is mixed with alcohol, by chemical reaction it forms chloroform. If bleach accidentally gets mixed with another cleaning agent which contains the acetone, it again forms the chloroform. It forms the sodium hydroxide, which is a corrosive base. It forms the sodium acetate also. If it accidentally gets mixed with the vinegar, ammonia, which most cleaners have all these things, they produce the toxic fumes. How the toxic fumes are? Well, as soon as the chloroform is formed, when upon mixing of lots of these cleaning reagents, it comes in contact with the air. Air is everywhere, right? The chloroform degrades. It degrades into carbon dioxide, carbon monoxide, hydrochloric acid, dichloromethane, phosgene, formal chloride. The worst part of it is the phosgene, because phosgene is a poisonous gas. It is that deadly gas which during World War II caused 85% of the death because of the chemical weapon exposure. So, big no to mixing of the reagents. And if, let's say, accidentally we have made it, now we have somewhere in the bottle in the corner of our home or in the office, how we should be disposing it off? Well, that chloroform, make sure the area is very well ventilated. Put the mask on, you don't have to inhale it. Mix that entire chloroform containing reagent in a huge amount of water, and then wash it away, flush it away with plenty of water, and then rinse your face afterwards with the water, flush, like clean everything, because chloroform can be you can definitely not going to drink it. Somebody might drink it so that it thinking that it is going to kill the SARS-CoV-2 virus. There are a few people out there who really don't know the science, but it can be readily absorbed through your skin also, by inhalation also. So after you come in the contact of the chloroform, you suspect you have exposure of chloroform, thoroughly do the gargles, wash your eyes, wash your face thoroughly with the water, wash your any exposed area of your skin thoroughly with the water, right? Because it is a very dangerous chemical and it causes sudden sniffer death, which is a fatal cardiac arrhythmia. That's why chloroform is a big no-no. It damages, like if let's say exposure, if exposure is for too long and too much quantity has been exposed to you, then definitely there is a chance of sudden sniffer's death syndrome. And let's say if you are exposed to chemical for the chloroform or a limited amount of a time, the time was less, the amount was less, that depending upon the time and amount you have been exposed to the chloroform, it can damage your eyes, lungs, nervous system, skin, liver, kidneys, and even may cause cancer. Now, the second myth: cold weather and snow can kill COVID virus. Is that true? No, it does not kill uh, COVID virus at all, because remember, whatever is the temperature outside, your body temperature is fixed, right? It is not going to change. And we know that the SARS-CoV-2 virus infect the nasal pathways first. So outside temperature really does not help us to kill the SARS-CoV-2 virus if we are really being infected with this or exposed be to the SARS-CoV-2 virus. So ठंडी में बैठने का कोई मतलब नहीं है. Just go and seek the help from the healthcare provider. Can COVID-19 virus spread at a huge rate in hot and humid climates? There were these rumors out there, okay, the summers are coming, it is going to spread like anything, so you have to be very aware, be careful, let's sit in the sun, maybe it will kill it, or all those kind of things were there out in the market. The fact is that the SARS-CoV-2 variant, which is not cannot spread, it should be cannot spread. Cannot is missing here, so cannot spread in hot and humid climates, right? So sitting in sun, taking the sun bath is good. It will sure give you the vitamin E, especially subah subah wala dhoop is very very good for your body, but it is definitely not going to prevent the SARS-CoV-2 infection. If you are suffering from it, it definitely helps to soothe your body, give your body the energy it needs. That is, you can say, give a God gift. Sunlight is a God gift, right? But it is, don't burn yourself in the skin. It can definitely can give you the sunburn. Some people are taking hot showers, very very hot bath. So be careful. It can relax your body. A good shower can relax your body, but it is not going to treat SARS-CoV-2 virus, right? It does not prevent the COVID infection at all. Catching COVID-19 does not mean you have it for life. If let's say unfortunately you had the infection, or one of your near dear one had the infection, or one of your anybody had the infection, it doesn't mean that you are not going to stay away from them. It is not like a chua chut ka bimari like the many other diseases have. It is just you are being cured now, your RT-PCR is negative, you don't have any signs and symptoms, your health care providers have told you that you are COVID-19 negative, you are clean and you are clear. That does not mean that entire life you are suffering from it and people should stay away from you, or you should put yourself in a room. Don't do that. It does not mean that you is going to have it for the entire life, right? It cannot be spread through mosquito bites. It cannot be spread through the house flies like the malaria in the malarial season. Yes, but if you are living in an area which is more prone to have the malaria kind of an infection, so just be careful. Let's say if you have the suspected temperature, you are feeling chilly, या fever हो गया, कुछ हो गया, बुखार हो गया, go and check for the malaria. Most of the times you will be having a malaria, not the SARS-CoV-2 virus. But mosquitoes and flies, there is no such study that really tells you or proves you that this is spreaded by the mosquito bite, or houseflies are carrying this infection from one place to another, from one home to another. It is not like that. There is no such study that is being reported so far. Hand dryers are not effective in killing COVID-19. What are hand dryers? I hope most of you know it. Whenever you are there in the public washrooms at a big place, in the washrooms, they don't have the paper towels or something for drying of hands, but rather they have this big blower underneath. You put your hand and you dry your hand. Those hand dryers are for drying only, the same way you dry your hand either with a paper towel or a cloth towel, whatever material it is made up of. It is just for drying your hand. It does not sanitize your hand. It does not it does not kill the virus if you have that virus or sitting on your skin. It does not do that. Okay, UV lamps. Many of the big restaurants here in India, they are being using the UV lamps for the packaged food so that it gets sanitizer and they are serving it to the people. So there were these wise people who thought that let me sanitize my hands also, because if it can sanitize the food, it can sanitize me also. Well, that is going to give you the bruises. It is not good for your skin. If you expose your eyes, your face fully to it, your eyes are gonna damage. So educate everybody around you. This, the purpose of this entire video is to make you aware, and I want you to spread this good news along around your friends, families, relatives ki bhaiya these are the myths, don't do it, and you should follow properly what is causing, what is not causing the COVID infection. Thermal scanners are the scanners by hand. We detect the temperature. Some initially they were doing it over here. That is a big no. It should be done inside the wrist side wala, idhar wala side pe usko wrist ke upar usko lete hain, and that should be approximately a few distance away from the hand itself. 1 meter का थोड़ा सा distance रख के उसको चलना होता है, not like this, but still that is telling you your external body temperature. Or sometimes this is telling you, let's say you came to the room after running और बाहर से धूप में से आके बैठे हो, then definitely thermal scanner is going to show the high temperature of your skin or your body. That doesn't mean you have the COVID infection, you are infected from COVID. It's just your body temperature. If you are feeling that you have a fever, go check with the healthcare provider. Go for the RT-PCR test to make sure whether you have it or not. But the thermal scanner are not an indicative of the COVID infection. Vaccine against pneumonia don't protect against SARS COVID-19 virus. Yes, it can help you it can help for the prevention of the pneumonia. There are studies out there that in the older people, where when they are living in this area in which they are more prone to get the pneumonia, they can go get the pneumonia vaccination. But pneumonia vaccination does not mean that the person getting vaccinated is not going to get the COVID infection. It's just a prevention measure for the pneumonia, not for the SARS-CoV-2. Okay. Antibiotic can't prevent or treat COVID-19. Oh my God. I cannot believe that all these pharma manufacturers are selling these antibiotics. Your azithromycin, your doxycycline, your tetracycline are being selling like a hot cake. Prices are soaring high, and everybody is becoming a doctor at home कि भैया कोविड होगा नहीं, prophylaxis के लिए खा लो, कुछ नहीं होता खा लो. But it is not like that. You should not be eating antibiotics. If you see somebody eating antibiotics for no reason, you should stop them and you should educate them that antibiotics are for the bacteria. COVID-19 is a SARS-CoV-2 virus. Antibiotics, they don't work upon the virus. They don't kill the virus. Right? So what will be the consequence of unnecessary use? Well, over the time, they will develop the resistance. We all know that. If they will develop the resistance against azithromycin, against doxycycline, against penicillin also, but जब real में infection होएगा, when they will really get sick, when they need that antibiotic is not going to work, because his or her body has developed the resistance against that antibiotic. Yes, in the hospitals, those who are suffering from the serious illness of SARS-CoV-2 virus, doctors are prescribing it. But those are doctors, right? They know what to give, what not to give. They are suspecting of the secondary infections in that patient because of the decreased immunity, because they are been suffering from SARS-CoV-2 virus. So secondary infection हो गया है. उस secondary infection को prevent के लिए, if doctor gives it, then it's okay. But if कोई खुद से लेना शुरू कर देता है कि yes, that is going to help me to give me a shield against the COVID infection, don't do that and don't let others doing that. So educate everybody about this, okay? people of all age can be infected by the COVID virus. There is no such thing कि कह दें कि बच्चों को नहीं होगा, बूढ़ों को हो जाएगा, males को नहीं होगा, females को नहीं होगा. It is not like that. Definitely, males and females equally are prone. But if we have to compare a little child to a 65-year-old person is can be either male or female, आदमी हो औरत हो, but 60 plus है and been suffering from the cardiovascular disease हो गया, उसको डायबिटीज का इश्यू है, उसको रेस्पिरेटरी का इश्यूज है, उसको और बहुत सारा एलर्जिक इश्यूज है, definitely then that person is more susceptible to get the COVID infection because he is old, plus he has all these kind of another clinical complications that is going on. His or her immunity level is low, तो मोर प्रोन हो जाएगा. अगर वही चीज इफ लेट्स से अ यंगर पर्सन हैज द सेम काइंड ऑफ इश्यूज, then similar way he is or she is more prone or susceptible to get the SARS-CoV-2 virus. So it is not gender based. It is, yes, definitely older peoples are more susceptible because they have all these other health related issues which make them more susceptible to the SARS-CoV-2 infection. Now, rinsing your nose with saline does not prevent COVID. Saline rinsing of the nose is good. When you are recovering from the COVID infection, it cleans your nostrils. It helps you to feel comfortable. It helps you to alleviate your symptoms. It helps you to recover, but it is not a treatment. So recovering, helping is different than the treatment. It is not a treatment. Eating garlic. Garlic has antimicrobial properties, good for body. Body is developing immunity, but it does not prevent the COVID infection. So don't you eat too much of the garlic. You might smell bad also. Eat garlic like a food you should eat. Adding pepper to your soup does not prevent or cure COVID-19 infection. Adding pepper definitely will give good flavor to your food, but it is not curing the COVID-19, not at all. Big no. The prolonged use of mask when properly worn does not cause carbon dioxide intoxication and nor the oxygen deficiencies. Many people are complaining कि भैया मास्क पहन के रखा है, अंदर ही अंदर इनहेल कर रहा है तो कार्बन डाइऑक्साइड इंटॉक्सिकेशन हो गया. तो well, it is not like that. Oxygen deficiency भी नहीं होता है, right? And that is proven by the doctors. But the question is, when a mask should be worn? Mask should be worn when you are out there in the public and people are very close proximity, less than 1 meter close में आना शुरू करते. You should be actually wearing the mask all the time whenever you are out of the home. That is a big suggestion. But let's say if you are in the mall, you should wear the mask. But let's say you are out there in the park, nobody is around you. You cannot see दूर दूर तक कोई बंदा नहीं देख रहा है. You can't really take off the mask. ठीक है ना? So when the mask should be worn when you are out there in the public, which is crowded place. How do I choose which mask fabric to buy, an ideal fit or a fabric of I make my own? किस तरह का चीज करना चाहिए? Well, you can have a cotton mask, but that should have a 3-layer mask. We have these kind of masks, right? We have this kind of a mask. This has 3 layers. Inside is the cotton layer. That is an absorbent layer because it touches your skin. Outside is a non-absorbent layer. In between those two, there is a 3rd layer, which is also a non-absorbent layer. Those kind of masks are okay. Then you have these masks, which are 3-ply masks, right? Usually used by, or medicinal mask, you can say, used by the doctors. They are one-time use. They are usually thrown away after used once. Then when afterwards we have this N95 mask. It says N95 mask is there. Inside it is white. Usually whenever the side that is white is inside, that goes. And here I don't know how clearly you can see, there is a pin here. That is when you wear the mask, that is this pin that comes above your nose. You have to secure it properly, and that does not have a respirator. Earlier there were masks who had the respirators. So are those respirators good or not? Well, first of all, which mask to use? You can use any mask. But definitely these masks should be discarded. These masks should be discarded after they are used once, they are soiled, discard them. But the cloth mask, you can wash it at the home. How do you wash it? Well, you can have this hot boiling water, you put the detergent into it, you put the mask into it, wash it, and then you can leave it outside in the sun to dry it off. Let's say you don't have the hot boiling water. You can wash it in the normal water, then boil for 1 minute in the hot boiling water, just for 1 minute, for the sake it is disinfected and cleansed properly. That is about the washing. But how do we wear the mask properly? Well, most of the people are like, ऐसे हाथ में लेके mask चलते हैं. This is wrong. You are infecting the mask and then you are breathing from it. So always handle the mask, always hold the mask from these two elastic bands. You hold these two elastic bands, wear it, and secure it properly from all the sides, from here, from here. And this is how you take it from the elastic bands, and then keep a Ziploc bag or any clean bag ready and put it away the same way. You should not be touching this part. Most of the people are like, बात कर रहे हैं ना, उसको उठा के नीचे करा, हाँ बोलना, उसको उठा के ऊपर करा. That is wrong. You are spoiling your mask by yourself. And just take it out, put it in a clear Ziploc or zipper bag, and put it away until it is used. Let's say that mask is sweaty आया, बहुत पसीना आया, वो गीला हो गया है. Make sure if it is needed to be discard कर दो, नहीं तो wash कर दो. Never use the soiled mask, that can create issues. तो वो use नहीं करना चाहिए. Now, what is the difference between medical mask and the respirators like 995? They both are equally good. Medical mask are for once use, एक बार use किया, throw कर दिया. Respirators like N95, you can use it over and over, right? And the white side part is the inside. You can use it like for good 3-4 days. If it is not spoiled or soiled by your sweat, right? Mask with exhalation valves are big no-no for the SARS-CoV-2 virus, because if the valve is there, valve will open up when you exhale and it will close when you inhale. So it is good, or it actually was made for the people who are working when there are the dust particles in the coal mines, so that they don't inhale those particles, because the valve is opening up when they are exhaling and valve is closing when they are inhaling. And those particles, the sand, soil, all those kind of a dust particles, they are bigger in size, so they cannot come in. But let's say if you are using those exhalation valves in this COVID mask, when you exhale, it is opening up, but when you inhale, the infection virus can come, because it is very, very in microns. The size of the virus is in microns. It comes inside when you inhale. So respiratory valves are exhalation valves with the valves. Any mask with the valve is not recommended by the WHO. Should people wear mask while exercising? Yes, they should not wear the mask. Why? Because definitely when we are exercising, our respiration rate is very, very high up. So that time it is producing an obstacle to your normal breathing rate, which can affect your respiratory system, which can decrease the oxygen concentration in your brain. You can lose the consciousness also. Your body will get fatigued more easily. You should not wear the mask, yes, but when people are in very close proximity while exercising, you should wear the mask, but don't do vigorous exercise at that point of a time. Second thing is, during exercises, we sweat a lot. Those sweat will make your mask wet, and the microbes will grow very easily. So try not to wear mask, and when you are doing exercise, try to do it in isolation, not in a crowded place. The likelihood of shoes spreading COVID-19 is very, very low. There is as such no studies or no anything which has indicated that you are out there in the market or in a mall or in a restaurant or in a museum, anywhere, and with the same shoes you come inside the home and you are carrying the SARS-CoV-2 virus. inside your home. There is no such studies or any incident has been reported so far, but definitely, let's say if somebody has small toddlers or crawling kids inside their home who are really um, touching the floor with their bare hands and everything, then definitely you should avoid bringing the shoes, the like infected shoes, from any kind of infection inside the home. Water or swimming does not transmit the COVID-19 virus. The only way you will get infected is when there are so many people in the swimming pool and they are in very close proximity to you, and you are being exposed to those SARS-CoV-2 virus for more than 15 minutes, then there are higher risk of getting the infection. So if you are doing the swimming, make sure everybody maintains the proper distance. Now, hydrochloroquinone does not prevent illness or death from the COVID-19, right? This is or death from the COVID-19. Hydrochloroquinone, chloroquinone were the drugs that were initially used as an anti-malarial drug. Initially, when the COVID-19 started, people were eating chloroquinone and hydrochloroquinone like anything. But studies have indicated, clearly confirmed, that it does not treat COVID infection. It does not kill the SARS-CoV-2 virus. It is just for the treatment of lupus erythematosus or rheumatoid arthritis. Is dexamethasone a treatment for all COVID-19 patients? Well, dexamethasone is a corticosteroid. It has this anti-inflammatory property. It is being given to the COVID patients, right? Because there is this clinical trial known as the recovery, in which there were patients were giving 6 milligram once daily for 10 days, both orally as well as IV. But the breastfed or the pregnant ladies were given prednisolone, a mild corticosteroid, either 40 mg by mouth or hydrocortisone 80 mg IV daily. So this was the clinical trial for the dexamethasone for the COVID-19, right? The normal patients are given, normal patient means those who are not breastfeeding, those who are not pregnant, right? They are being given the 6 mg once daily for 10 days. Pregnant and breastfed ladies were not given the dexamethasone, but a milder corticosteroids like prednisolone, like hydrocortisone. Prednisolone was given 40 mg by mouth and hydrocortisone was given 80 mg IV twice daily. This was made sure that those patients who has been started on the oral dose, they were not given the IV dose, or those who have started in the trial with the IV, they were not given the oral. So that interchange was not there. Initially, if the treatment has been started with the oral, the entire trial phase, they were given the oral dose. And for the IV, they were entire trial, they were given the IV dose. And it has proven that dexamethasone is helpful in treating, in alleviate the symptoms of the COVID-19, right? Is dexamethasone on WHO essential medicine list? Yes, it is. Since 1977, it is on the list for the allergic or hypersensitive conditions, pain and edema, nausea and vomiting, for the treatment which is related to the blood tissue cancers, for the cytokine related lung injury, and for preventing and treating ARDS, right? So these two were already in the list. So dexamethasone is on the WHO essential medicine list and are being used accepted widely for treating the COVID infection, right? And both medicines, the dexamethasone, hydrocortisone and prednisolone, they are recommended in the children. Minerals and vitamin supplements, are they curing COVID-19? No, they are not curing COVID-19. But yes, vitamin D helps you to maintain your healthy immunity, body immunity, prepares your body to fight for the infection, keeps your body strong, right? People are taking zinc also. Zinc is also good for the immunity of your body. There are like almost 120, I know, I can read it from the list here. Vitamin D, zinc, elderberry, medicinal mushrooms are there, selenium, garlic, licorice, curcumin, vitamin B complex. All these things are there to boost your immunity. It has nothing to do with like in SARS-CoV-2 infection or treatment. It is a supportive thing that is help, because if your immunity is good, you can fight for the infection, right? You are preparing your body to fight. But definitely जैसे होता है कि when you are there out there in the war, लड़ने के लिए you need a gun, you need a sword, all those things of utensils. So that is your treatment. But to support that treatment, तुमको क्या चाहिए? You need your courage. You should be your body should be filled. लड़ने के लिए पेट भरा होना चाहिए, बॉडी टफ होनी चाहिए, तुम बहुत स्ट्रांग होनी चाहिए. So the vitamins and minerals are making you strong, helping you to prepare for the war or fight against the SARS-CoV-2 virus. But the tools or the medicines are prescribed by the healthcare providers are helping you to treat the COVID infection. ठीक है. Now this is my humble request. जैसा हाथ जोड़ के I request everybody let us stop this infodemic curve. Pandemic हो गया है, but this information का जो epidemic बाहर आ गया है, people are thinking नाक पकड़ के उल्टा खड़े हो जाओ, 10 घंटे सर के बल खड़े हो जाओ, that is going to treat the COVID-19. काला धागा बांध लो, नींबू काट के घर पे लटका लो, that is going to prevent the COVID-19. ऐसा नहीं होता है, right? So there are three kind of a people, right, who out of those few are spreading it more. Like this are the red people who got their got their news from the trusted source, right? And now trusted source से after trusting it कि trust की source से आया, they are spreading the news where this is the trusted news. This is sure shot is going to help you boost your immunity, help you to how to keep your home disinfected, how to wash your vegetables, and that is proven, right? And there are few people like who did not send a rumor at all. He knows something, but he is not spreading rumor. This person double checking their face, right? So all these sort of variety of people are out there. कुछ लोग तो कुछ देखते नहीं है, सुनते नहीं है, जो सुना आगे स्प्रेड कर दिया, WhatsApp, Facebook, and then अच्छा ऐसा हो गया, अच्छा ऐसा हो गया. हाँ, there is this village in which there is this goat who gives the milk. If you drink that milk, you are away from the SARS-CoV-2 virus, right? So whenever we get the information, check the source, cross-check whether it is true or not, and think twice, thrice. Should I spread it or not? If you are not confident, don't spread it, because many a time unconsciously we spread a chaos. कोई घबरा जाता है, राइट, कि ऐसा मैंने खाया, मैंने ऐसा किया, ओ माय गॉड. तो दैट इमोशनल सेटबैक इज आल्सो बैड. सो लेट्स फ्लैटन द इन्फोडेमिक कर्व एंड विश यू ऑल, आई प्रे टू गॉड कि सब जगह सुख शांति और एवरीबडी इज हेल्दी, फैमिलीज आर स्टे एंड सेफ. थैंक यू वेरी मच. All the references are from the WHO, World Health Organization. So remember guys, if it were easy, everyone would be a doctor. The content of the entire presentation was taken from the WHO resources, that is World Health Organization. If it were easy, everyone would be a doctor. This is the best job in the world, despite everything, because of everything. So I just want to wish everybody a healthy family, a healthy life. सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखमाप्नुयात्. ओम शांति.